Doctor, my child has severe watery diarrhea and a high fever. For medical staff, this combination of symptoms points toward a single microscopic threat. These spiked spherical shells belong to rotavirus. Highly active during winter seasons, this pathogen is the leading cause of severe diarrhea in children globally. An infection typically begins with a sudden, intense fever and persistent vomiting. This phase gives way to massive watery diarrhea, characterized by a sharp, identifiable sour smell. Lethality comes from the sheer speed at which the virus forces the body to purge its life-sustaining fluids. This continuous purging leads to rapid, severe dehydration, the primary driver of pediatric mortality in these cases. This diagram shows the virus attacking the intestinal lining. As the spiked particles compromise the cellular wall, the gut loses its ability to retain water, and the body's fluid reserves flush out of the system. Specific physical changes indicate the onset of severe fluid loss. Parents may notice the eyes sinking into the sockets, or the tongue becoming completely dry. A critical threshold for medical intervention is the 6-hour mark. If a child goes this long without passing urine, the situation has become a clinical emergency. Missing these physical cues allows dehydration to progress into physiological collapse, necessitating an IV drip to stabilize the child. Desperate to stop the diarrhea, parents often mistakenly reach for antibiotics. Antibiotics target bacteria. They have no effect on viruses and simply bounce off the rotavirus particles. Instead, these ineffective pills strike the gut wall, disrupting healthy bacteria and damaging the already vulnerable intestinal lining. Relying on antibiotics worsens the situation by accelerating the dehydration process and further compromising gut health. Stabilizing the child requires an immediate shift to oral rehydration solution, or ORS. Caretakers must provide this solution in small, continuous amounts immediately after every instance of diarrhea. This microscopic view shows how ORS works. The specific ratio of salt and sugar forces water to bypass the damaged cellular gaps, moving directly back into the bloodstream. ORS acts as a vital bridge, maintaining the body's water levels until the viral infection clears the system naturally. Once hydration is stabilized, the second phase of the protocol begins: zinc therapy. Zinc serves as a structural repair agent, patching microscopic damage on the intestinal lining and reinforcing the cellular wall. For this repair to hold, zinc must be administered for exactly 14 days. This timeline is mandatory, even if diarrhea stops early. Completing the full 2-week cycle fortifies the gut, significantly reducing the likelihood of a follow-up infection. This dual strategy uses ORS to manage the immediate fluid crisis and zinc to execute the long-term structural repair. Managing a dehydration crisis is a reactive measure. The long-term goal is to prevent the initial viral breach. The rotavirus vaccine serves as the primary preventative measure. This vaccine is administered as oral drops rather than a needle, making the process painless for the infant. Adhering to the standard pediatric immunization schedule ensures the vaccine is delivered during the correct developmental window for maximum efficacy. Timely vaccination prepares the immune system to neutralize the virus on contact, preventing it from ever establishing a foothold in the intestines. Effectively battling rotavirus depends on 3 specific actions: immediate ORS for hydration, a 14-day zinc cycle for repair, and preventative vaccination. Caretakers serve as the first observers of the watery, sour-smelling symptoms that signal an infection. A clear understanding of the gut's biology makes a once deadly pediatric threat entirely manageable.